Many people ask us what are the difference between dentures and implants. So implants very simply are a screw retained or something that actually goes into the bone, and it is to replace a missing tooth. Dentures, however, are generally removable, so it's something that you can take out. But again, it's to replace a missing tooth or missing teeth. So with implants, you usually need to have enough bone that's preserved in the mouth in order for the screw to be put in. It's done through a surgical process, but it's not that scary. It's generally done within a matter of an hour or two, and it's a very, very quick little drill into the bone, and an implant is placed. And on top of that implant, we put a tooth or a crown, or we use it to secure a denture if you're missing more than one or two teeth. So with a denture, it doesn't go into the bone, it basically sits on top of the gum. So we make it to fit what's left in the mouth and fill any of the gaps. But you can actually take it out, so you can remove it and clean it. Whereas with implant, it's fixed, so it doesn't come out, and you would clean it the same way as you clean your teeth. So implants and dentures from start to finish can take slightly different timelines. So a denture is something that we can make within a short space of time, a couple of visits, maybe 3 to 4 visits, and we can have it ready within a week or two. In some circumstances, we can have it ready within 24 hours or same day if needs be. Whereas implants are slightly longer timeline. So the screw would go into the bone, so slight small drill, a little bit of surgery. We put the screw into the bone and we have to wait for that to heal. So that takes a couple of weeks. So we generally would say, a bit like any kind of bone healing, 6 to 8 weeks, and just wait for that to heal and set with the bone. And at that point then we would look at putting in the next stage. So we put a little abutment or a little piece that goes in on top of that screw, and we measure up for the tooth that's going to go on top of it, or the crown, and that takes another couple of weeks. So from start to finish, it takes about 3 months for your implant to be fit and to heal and to have the tooth that's going to replace the missing tooth. Whereas with dentures, we can probably do it in a day, but generally in and around a week or two to replace those missing teeth. So like with all surgery, even if it's minor surgery, which an implant would be, there can of course be complications. So there could be a situation where maybe the bone doesn't knit to the implant and it's not as successful as planned. But when it comes to implants, we try and do all of the investigation beforehand. So we check the bone, we do the scan of the mouth to make sure there's enough bone density for it. In relation to dentures, there's very little that could go wrong. There's very little complications. We do all the measurements at the start to make sure it fits you really well, it functions for you properly so it works and you can chew, and also so that it looks great and it looks natural. A lot of people wonder if you have to be a specific age to get dentures or a specific age to get implants. So the answer to both of those is no. We can do implants at any age. We check the bone, and if you're healthy and well and your bone is able to withstand the implant, we can certainly do an implant. And the same likewise with a denture. A lot of people associate dentures with that age-old picture of maybe their nana's teeth or their granddad's teeth in a glass, but it's not the case anymore. A lot of younger people, because they lose teeth at a younger age, they have a replacement. So they use a partial denture to replace some of those teeth, and it's removable. So you can be any age for either dentures or implants. It depends on what you need, what you want, and whether or not your mouth and your bone can actually withstand either the implant or the denture. So I hope this information was useful and it will help you make a decision as to whether you need dentures or you want to have dentures or whether you want to have implants. And sure, look, if not, please feel free, give us a call, follow us on social media, book in for a free consultation with us. We'll have a chat with you and we'll help guide you on that decision-making process. Oh, and by the way, if there's any topics that you'd like more information on, please feel free to send us a message, leave it in the chat, or follow us on social media, and we'd be delighted to actually post a video on it. Thank you.